Hello, everybody. My name is, like I mentioned, Trevor Wilkins. I run DayVue. I'm the CEO. I'll get into that in a second. Another one of my hats at work. My day job is the head of growth for Scale Health. We're a healthcare innovation marketplace. It means we help bring healthcare startups to market through education, contact, and also consultation, which is really kind of how I fell into this world. So I'll share my screen and also talk about what DayVue is and the story behind it, and just how we are, looking to establish this mission of symptom visualization, but also understanding that we walk in every room with people that we can learn from. So, I started this company actually. I come from the startup and then VC world. I was working for an accelerator here in Los Angeles, realized that there was a big lack of communication between founders and investors. I developed this SMS-based platform where startup companies could easily report the KPIs that they needed to report to their investors on a regular basis, and essentially solve the problem for a lack of knowledge that I saw at my fund to the companies that we had invested in. I, within that time, tested this platform and realized that this was not the biggest need in the space, but around that time was transitioning to Scale Health, where I had a conversation with UCLA Health, kind of around some of their population health needs. And one of the biggest things that they mentioned was that they did not have any visualization or understanding of where their companies were as soon as they left their care, whether it be ER or whether it be kind of from a chronic standpoint. So that's the problem and kind of opportunity that my team and I saw in this place with this. We were sitting there with this SMS platform. We knew that relationship data management was important. We were just kind of looking for, we're founders at heart, and we kind of saw this opportunity and saw that there was a real need here. Saw that chronic patients have few ways to show how they're feeling between visits. And then on the other side, post-operative, as we kind of found down the line, is that many surgeries are redone due to a lack of adherence to PT afterwards, but also a lack of having understanding of where issues really lie from a symptom standpoint. And of course, this costs payers, but families, providers, et cetera, billions of dollars on an annual basis with post-operative and then these other silent diseases. So our goal, as it says here in our value proposition, we aim to help 3Ps, payers, providers, and patients really kind of visualize and be able to speak to their symptoms over time. In a perfect world, help chronic patients understand their best days and repeat them, while helping post-operative patients really have an understanding of what's important post-operation as they kind of assimilate back to regular life, their normal lives. So how it works currently, and I'll kind of speak to the pilots that we've executed thus far. Actually, I'd like to take a second to shout out Jacqueline again here, because she connected us to one of our advisors, Sarah Dillingham, who I think will be joining later today, but kind of had a lot of great perspective around how to actually contact our patients. We are not an app by design. There's a lot of apps on people's phones. We take that real estate on our phones more and more seriously today. Text messages have about a 92% open rate. And by being able to just go off of a limited amount of data that we get from patients, and also having limited amount of data on them, kind of provides some opportunities for us to adhere to PII and HIPAA compliance as well. So how does it work? We essentially, over this last summer, worked with about 40 patients from Sarah's online rheumatoid arthritis patient group on Facebook. She's the largest one in the world. We worked with about 40 patients there through the group concept. We sent them 2 text messages a day, 2 text messages a day for twice a week. 4 text messages in total. First text message would be in the morning, reminding the patient of how they felt during previous check-ins. The second one would be a text message that they would receive with a link that would take them to a web app that would essentially ask them to fill out on a scale of 1 to 10 how their pain, swelling, and fatigue were. This worked out pretty well for us. We saw, and then last piece, they then have the opportunity to take it to their doctor and kind of provide a better perspective on how they're doing in between visits. Now, for us, we did this with the first pilot without any sort of doctors. We did not engage any sort of providers. We just wanted to see what people actually use this. And actually, let me take a step back. I'll get to the business model in a second. But essentially, we set this up, and for all of our patients, actually, it was their first time having a digital pain journal. So we still have them on today, even after we finished up the pilot. Really just kind of, like we said, wanted to prove concept as to whether or not they would respond to it. So we had about 45% month over month usage for those 3 months, and then kind of teetered off. We're at about still servicing about 25% of those patients, which we're pretty happy about. Business model. So because it is SMS, we figured out a way to charge as little as $11 per patient per year. We've also identified through the RTM codes that have recently come out by the AMA that providers are able to reimburse up to $20, usually in between $17 and $20 via CPT codes, which we're really excited about because we essentially think we might be able to not only provide this platform for net free, but also be able to help doctors make a little bit of money on the front end to actually onboard these patients. Additionally, we look to recoup anywhere from 30 to 50% of doctors' revenues from codes 98981 and 98980, which could equal to up to about $100 per patient per month, possibly. Our go-to-market strategy. So as mentioned in Q3 of 2021, we texted 40 patients twice a week, saw our average response rate 40%, piloted with doctors. We just wrapped up a pilot at the top of the month. And while we had good numbers in terms of executing a pilot with 100% of the patients who signed up responding to the text over 3 months, what we did realize is, especially with a platform like this, we do need to have a little bit more focus for the doctors that we work with. So we're in the process now of bringing up on another pilot with them, as it says here in Q3 2022, where not only will we be proving reimbursement amongst those codes down there, which I'll speak to in a second, but also providing a very clear, very succinct outline as to how doctors should engage their patients and onboard and really take advantage of not only providing benefits to their patients, but us proving as to when they should be reaching out to their patients as well. So CPT codes to be built and kind of where our business model again lies. 98975, that's the first code that you're able to bill that really kind of covers the cost overall of the platform. The 98977 covers patients that enter 16 days of data. So one of the things that we're going to be adding to our platform currently, we text patients about 8 days a week. We are going to open that up so that they have the opportunity to actually update their platform on a daily basis. And so that is where code 98977 comes into play. Currently, it's 16 days. So as we work with doctors, we will alert them as to when patients have reached the 16th day and split some of the profits there with them. CPT codes 98980 and 81. A lot of jargon there, but essentially for every 20 minutes, for every patient that completes, basically enters data on the platform over monthly, they then have the opportunity to investigate and really kind of work with that data, and then from there have the opportunity to reach out to the patient for like another anywhere from $30 to $45, and then every 20 minutes after that, it's another kind of $30 to $45 as well. And as I said, that and 98977 on the last page. This comes out to about $40 as well. So net kind of have the opportunity to make anywhere from about $100 to $120 per month. So competitive analysis, as we see it, we kind of beat out a good amount of these platforms, just kind of what's on the market today, really in our engagement, over here in terms of how we engage the patient. What we've seen and frankly, what we've learned from our advisors and from our patients is, you'll hop on these apps for a little bit. They'll be very engaging. They'll be, satisfying for a while, but either, there is either alert fatigue, or there's no way to connect with your doctor, or the consistent check-in just doesn't feel natural. That's really kind of one of the things that we wanted to make sure that we did here. So SMS and then timing of SMS is really something that we're trying to hold true to. So that's really kind of how we see ourselves differentiating from kind of our competitors. So from a pilot onboarding and goals standpoint, we are, as I mentioned, we've proven that not only will patients use this, we've proven that if given the platform by their actual provider, that they have a higher chance of actually engaging with it on a consistent basis. We now want to prove that, not only will they use it, not only will they hop on board, but we can provide this for free, but also provide the opportunity for them to understand when they could actually make money off this as well. So I've broken the onboarding down into a crawl, walk, run stage as we go into this next pilot with we're working with a rheumatologist out of North Carolina. And so we already have the symptoms, but I'm going to be going through this again with him just to kind of prove them out again. First, choosing the symptoms and kind of what the outcomes that we want to focus on are. Establish baseline and goals of each of these specific outcomes for him. The thing that really kind of said keep him coming back is being able to have this data and insight on how his patients are doing, and then also being able to shave off some time from each one of his interactions with his patients. From there, looking to confirm the reimbursement strategy. We've just kind of done that, confirmed that we will be able to reimburse for the platform for this pilot. And then we're going to start onboarding patients probably within the next 2 weeks or so throughout May, and then looking to execute that reimbursement at the top of June. From a walk standpoint, so we'll monitor these patients again over another 3 months. And as we see them interacting with the platform 16 times for CPT code 98977, and during interacting with the platform enough to the point where they have the ability to call them, we'll focus on 989-081. I still need to figure out exactly what that threshold is, but I know that it is a smaller threshold in terms of being able to reach out to patients. And then I flip those, but still in this walk stage, we want to make sure that we're getting the information and being able to help the doctor, being able to alert the doctor when to reach out, but also alerting the doctor and walking through the process of being able to monetize from it. Run stage, of course, I see this probably happening within the next 8 months to a year or so, but we want to be able to show and assess some sort of outcomes. We know that that's a long, arduous process, but from at least a provider standpoint, I'd like to provide some insights and some more qualitative outcomes around ease of use and really kind of helping prevent being able to kind of provide a better and cleaner understanding of data between patient and doctor. And then again, being able to identify and bill for these different codes consistently, and then being able to really kind of continue to make this a viable platform. A little bit about our management team. Myself, former founder, former investor in the EdTech space. My co-founder, Robert Hadari, Chicago-born serial entrepreneur. He's currently a contractor, developer. I'm also working with Kaiser Permanente, so we have some great insight there. He's worked with some of the top four consulting funds from a financial visualization standpoint. So really excited for a lot of the data visualization experience that hope we'll be able to bring to the table as well. Really appreciate your time. Would love to hear any sorts of feedback. I have some questions as well, but kind of high level. Jacqueline kind of laid this out and kind of gave a little bit of insight of the type of folks that will be here, but would love to kind of learn more about feedback and insights you guys feel about the platform, but also how we might be able to help Alaska. We've had a lot of conversation around kind of the challenges that you guys face and kind of where this might be able to fill in. And I think that's one of the cooler parts about my job and my position is being able to understand, best product market fit. And that's kind of what we're trying to understand at the moment. And I think that DayVue might be, for us, I think that kind of rural populations really might be something where we might be able to have an impact. So again, thank you all for your time. I really appreciate it, and welcome any questions.
Awesome. Thank you very much. If everybody would give Trevor a round of applause, I would appreciate it. That was awesome. Thank you so much.
Thank you.
So I always have questions, but I'd like to open the floor up. Would anybody in our audience like to unmute? We're a small group, so just simply unmute and maybe step forward.
Yeah, hey, Jacqueline, this is Eric. Hey, Trevor. Yeah, this is really interesting. I never really thought about, so SMS is like text messaging or it's a component of it. And so somebody's going to fill out the scales you had through the SMS, is that right?
So thank you for actually asking that question. I should have clarified. They're going to respond to so they will receive a link via SMS. And that link will be specifically tied to their phone number. Yep.
And we do have a question in the chat from Julie. She said, thank you so much, Trevor. Can you talk about how you are identifying your early target customers, your doctors and your patients?
Yeah, absolutely. Great question. And, I think it comes down to just having as many conversations as possible. We started in the rheumatoid arthritis space after a conversation with a innovation lab out of Pittsburgh, who, at first I was kind of looking at going towards diabetes, going towards post-operative, or still looking at post-operative, but kind of reducing readmission rates over 90 days. And the gentleman there just kind of mentioned, he was like, there's a lot of attention there. There's a lot of players there, focusing on a kind of lesser acknowledged population size like rheumatoid arthritis was where we did our research and said, this is an underserved market and we'll start. So I think kind of logistically, like how are we looking at it, just really kind of trying to see where, who's looking, what type of groups are looking for low tech, affordable platforms that are trying to scale rapidly to a large amount of people. We understand, and then just kind of thinking about who might have aligned incentives with what we're trying to accomplish as well. The reason that we actually opened up our focus from just chronic patients to post-operative is because chronic patients, as we saw over time, they live with a certain disease state, they're going to have this, and it's easy to kind of fall away from that, whereas post-operative is very much so, it's a shorter amount of time, but there's higher incentive to actually use it. So yeah, that's kind of a long-winded answer about how we're kind of finding product market fit.
Wonderful. Trevor, there is a comment by Jared Fuller and he says, I've done a lot of work in rural Alaska and have to say this is ideal. Our communities are off the road system, often don't have anything close to broadband, but text is often more reliable than phone voice service. The combination of availability and ease of use, people have familiarity with phones, makes great sense. So that's some really nice validation.
Yeah.
There.
Jared, absolutely. And thank you for that comment. That was actually kind of one of the questions that I think I've been trying to answer on my end. I think that we have a good opportunity from an Alaskan standpoint. And I'm actually speaking with Emily from Wellhaven, who presented a couple weeks ago here. We're catching up. We caught up a couple weeks ago. She had very similar feedback, but To kind of add on to Julie's question, Jared, yeah, to your point, we were thinking that, more and more as we have these conversations and understanding of where we might lie, we feel as though rural populations might work for us for a couple of reasons. One, as you mentioned, just kind of like digital cell service and just like access to technology, text message, being able to, kind of have that low tech connection to people. Two, a lot of these, as you guys all know, a lot of these rural care healthcare providers are the only ones in the space, and may not have the foot traffic to kind of have the same like revenues as other groups. And also they have, at the same time, they have the most people relying on them, or I should say people relying on them heavily, more heavily kind of per capita. So we see this as a way where if we can provide this, at scale for free, or to kind of net free for the doctors, and kind of develop a platform where we can not only help them make money, but help identify opportunities where they can be kind of compensated through these new codes. We think we really can see an impact there. And it's, I guess I'll kind of like provide a little bit of like my background, like, and how it relates to me. Like, to be honest with you, came into this from a venture capital, like VC kind of startup standpoint, but, working with Scale Health and also like having the opportunity to see like the kind of sheer impact of how we'll be able to do this potentially like broadly is like really just kind of inspiring. So, all of this feedback really helps a lot. I think that, especially being able to provide this type of platform where a lot of other devices, may cost in some places, what rent or what other bills might cost, and being able to kind of provide this for free, I think is something that really gets me up and going. So this kind of feedback really helps.
Awesome. I'm in that sad space where I always wish that we had more time sometimes, because this has been a wonderful conversation, but would like to open it up before I close. Is there anybody with one last question that they have for Trevor? No? All right. Well, I want to thank you all for coming. And Trevor, this is your opportunity. What is one thing that we could do for you as a community?
Yeah, absolutely. Well, I think, being able to connect with groups, Eric, like would love to connect with you to just kind of have a conversation around how we might be able to help Alaska out. Jacqueline, you've kind of given me some insights around the issues that Alaska faces. Interestingly enough, it's kind of helped shape my conversation for other groups like Pima County, Arizona, which kind of deals with some of the other behavioral health issues that we talked about before, and kind of using that as a blueprint. So yeah, I think that Alaska is definitely a great place where DayVue could have a lot of impact. So I'd say if if there is kind of a suggestion or insight, we're open to as much as possible. That's what I came here looking for. So if you don't mind connecting with me on LinkedIn, or even kind of sending out an email, Jacqueline has my information. I would really, really appreciate it.
Awesome. Well, thank you so much. Oh, and one last comment. Becky says that this could be used in veterinary clinic. I hadn't thought about Becky.
Oh, wow. I've never thought about that one.
That is awesome. Well, thank you. So before we close, first of all, another round of applause, or I'll just do that. But thank you very much, Trevor. This has been wonderful. So
cool.
Yes, and then the last 2 points I'd like to share with everybody is that our next Open Innovation will be on May 12th. It will be with Douglas Franklin with Airhound. Some of you also know Douglas. And then I also just want to point out that Health Tie and Emily Bile, who's also been mentioned, we're working with Bethany Burgess with the Care for the Care campaign. And this is Hospice of Anchorage's effort to make sure that people who take care of their loved ones who have Alzheimer's or dementia, that they also receive a box of care items and remember to take care of themselves. So if anybody knows of anyone that would like to contribute financially or with products to that campaign, please let me know. Otherwise, I just want to thank you all for coming today. It's been wonderful to have you. And thank you again, Trevor. I will certainly be following up. So have an awesome Thursday, everyone, and talk to you in May.
Thank you so much. Talk to you soon.